You wake up every morning and do what millions of health-conscious people do. You squeeze fresh lemon into a glass of water and drink it, proud of starting your day with something natural and healthy. You've read articles praising lemon water for detoxification, weight loss, digestion, and immune support. It seems like the perfect healthy habit. But what if I told you that the way most seniors drink lemon water is not just ineffective, but actually dangerous? What if drinking lemon water the wrong way can destroy your tooth enamel, causing permanent damage and extreme sensitivity, trigger dangerous acid reflux that damages your esophagus and increases cancer risk, interact with critical medications, making them toxic or ineffective, cause severe dehydration and dangerous electrolyte imbalances, worsen kidney stones leading to excruciating pain and potential kidney damage, spike blood sugar in ways that accelerate diabetes, and create nutrient deficiencies by interfering with mineral absorption? What if 7 specific mistakes made by the majority of seniors drinking lemon water are causing serious health complications? Emergency room visits and permanent damage to teeth, digestive systems, and kidneys? Yet almost nobody is warning you because lemon water has such a powerful health halo. These aren't theoretical risks. These are documented medical complications reported by dentists, gastroenterologists, and emergency physicians. The dangers intensify after 60 when your tooth enamel is thinner, your digestive system is more sensitive, you're on multiple medications, and your kidneys are less efficient. Today, the 7 dangerous ways seniors drink lemon water that most people don't know about. I'm revealing exactly what these mistakes are, why they're so dangerous after 60. What happens in your body when you make them? And the only safe way to consume lemon water if you choose to drink it at all. Stay until the end because dangerous mistake number 1 is made by over 90% of people who drink lemon water daily, and it's causing permanent, irreversible tooth damage that dentists are seeing in epidemic proportions. Before we start, be honest in the comments. Do you drink lemon water? How do you prepare it? When do you drink it? And have you noticed any tooth sensitivity, digestive problems, or other issues? Your current method could be damaging your body right now. And dangerous mistake number 1 is so universally made and so permanently damaging that dentists can identify lemon water drinkers just by looking at their teeth, and the damage is irreversible. Now let's expose these dangerous lemon water mistakes, starting with number 7. But understand this clearly. Each mistake on this list is more dangerous than the one before. And dangerous mistake number 1, the one we're building to, is made by almost everyone who drinks lemon water and causes damage so severe that it's changing how dentists view this supposedly healthy habit. This next one interferes with critical medications and can be life-threatening. Dangerous mistake number 7, drinking lemon water while taking certain medications without medical supervision. If you're on medications, lemon water can create dangerous interactions that most doctors don't specifically warn about, and that can range from reduced medication effectiveness to life-threatening toxicity. Here's what creates the danger with specific medication classes. Lemon water can dramatically affect how your body absorbs certain antibiotics. Fluoroquinol antibiotics, including commonly prescribed for UTIs and respiratory infections, bind to the citric acid in lemon water, creating complexes that cannot be absorbed. You may absorb only 20 to 30% of your prescribed dose instead of the full amount. The infection doesn't clear properly. Bacteria develop resistance. You remain sick. Lemon water significantly increases absorption of aluminum-containing antacids. If you take antacids like Maalox or Melanta and drink lemon water, the citric acid increases aluminum absorption dramatically. Aluminum can accumulate in your brain, contributing to cognitive decline and potentially dementia. After 60, when aluminum clearance is slower, this accumulation is particularly dangerous. Lemon water can interfere with thyroid medications, including levothyroxine. The citric acid and vitamin C can reduce thyroid hormone absorption. Your thyroid levels become suboptimal despite taking medication. You experience fatigue, weight gain, and worsening thyroid function. Lemon water can enhance absorption of certain medications, causing toxic levels. Some chemotherapy drugs, certain blood pressure medications, and other drugs can reach toxic levels when combined with substances that increase their absorption. Here's what makes this particularly dangerous after 60. Seniors typically take multiple medications. The chances of a problematic interaction increase with each medication. Kidney and liver function decline with age, making medication levels less predictable and more prone to accumulation. You're more vulnerable to medication side effects and toxicity. I worked with Helen 76, taking ciprofloxacin for a urinary tract infection. She drank lemon water every morning, including the morning she took her antibiotic. After 7 days of treatment, her symptoms hadn't improved. Her doctor assumed the infection was resistant and prescribed a different antibiotic. When we identified that she was taking the antibiotic with lemon water, which was binding the medication and preventing absorption, we separated them by at least 4 hours. Her next infection cleared properly with appropriate antibiotic absorption. The medication interaction strategy is critical. If you take any prescription medications, ask your pharmacist specifically about interactions with lemon water or citrus before consuming lemon water regularly. Never take medications with lemon water. Always use plain water to take pills. Separate lemon water consumption from medication timing by at least 2 to 4 hours before or after taking medications. If you're on thyroid medication, antibiotics, or aluminum-containing antacids, avoid lemon water entirely or use it only with explicit medical approval. Get regular blood work to monitor medication levels if you're combining lemon water with critical medications like thyroid hormones. This awareness and separation prevents medication failures and toxic accumulations that can have serious health consequences. This next one causes dangerous acid reflux and can damage your esophagus permanently. Dangerous mistake number 6, drinking lemon water on an empty stomach first thing in the morning. This is perhaps the most commonly recommended way to drink lemon water, promoted by health influencers and wellness websites everywhere. Drink lemon water first thing in the morning on an empty stomach for detoxification. But for many seniors, this timing is dangerous. Here's what creates the problem. Lemon juice is highly acidic, with a pH around 2 to 3, similar to stomach acid. When you drink lemon water on an empty stomach, especially first thing in the morning, the concentrated acid hits your stomach lining and esophagus with nothing to buffer it. After 60, several factors make this particularly problematic. Your stomach produces less protective mucus. The mucus layer that protects your stomach lining from acid thins with age. Your lower esophageal sphincter weakens. This is the muscular valve between your esophagus and stomach. When weak, it allows acid to flow backward into your esophagus. Many seniors already have gastroesophageal reflux disease or hiatal hernia. Lemon water on an empty stomach worsens these conditions dramatically. Here's what happens when you drink acidic lemon water on an empty stomach. The acid irritates your stomach lining, potentially causing gastritis, inflammation of the stomach. The acid can flow backward into your esophagus, causing heartburn, chest pain, and chronic acid reflux. The chronic acid exposure damages your esophageal lining over time. This damage can lead to Barrett's esophagus, a precancerous condition, or esophageal ulcers. The acid stimulates excessive stomach acid production throughout the day, creating a cycle of chronic reflux. Additionally, drinking anything acidic on an empty stomach, especially in the morning when stomach acid is already present from overnight fasting, can trigger nausea in sensitive individuals. I remember working with Doritz 73, who had been drinking lemon water every morning on an empty stomach for 2 years after reading it was healthy. She developed progressively worsening heartburn, chronic throat irritation, and a persistent cough. Her doctor diagnosed severe acid reflux and early Barrett's esophagus. He asked about dietary acid sources. The daily morning lemon water had been chronically bathing her esophagus in acid, causing the damage. When she stopped the lemon water completely, her symptoms improved over several months, but the Barrett's esophagus damage was permanent and required ongoing monitoring. The timing strategy is critical if you drink lemon water at all. Never drink lemon water on an empty stomach, especially not first thing in the morning. If you want to drink lemon water, only do so with or after a meal, never before. Food buffers the acid and protects your stomach and esophageal lining. Dilute lemon water more heavily than most recipes suggest. Use only half a lemon or even a quarter lemon in a full glass of water. Limit frequency. Don't drink lemon water daily. A few times per week maximum provides any potential benefits without the chronic acid exposure. If you have any history of acid reflux, GERD, stomach ulcers, Barrett's esophagus, or hiatal hernia, avoid lemon water completely. The acid will worsen your condition. This timing and dilution awareness prevents the esophageal damage that can lead to precancerous changes and chronic digestive problems. This next one destroys critical nutrients your aging body desperately needs. Dangerous mistake number 5, drinking lemon water with meals or supplements. Many people drink lemon water with meals, believing it aids digestion. While lemon water might stimulate digestive enzymes in some people, it creates a significant problem with mineral absorption. Here's what creates the danger. Lemon juice contains citric acid and vitamin C, both of which can bind to certain minerals, creating complexes that affect absorption. The effect is mineral-specific and complex. Citric acid can enhance iron absorption from plant foods in some contexts. This might be beneficial for people with iron deficiency, but vitamin C in high amounts can interfere with copper absorption. Copper is essential for connective tissue health, immune function, and cardiovascular health. The combination of acids and vitamin C can interfere with calcium absorption from dairy or supplements. Calcium needs an optimal pH range for absorption. Too much acid skews the pH and reduces absorption. After 60, when mineral absorption is already declining and when you need maximum calcium for bone health, copper for cardiovascular health, and balanced minerals for overall function. This interference becomes particularly problematic. Here's the specific danger with supplements. If you take calcium supplements with or near lemon water consumption, the citric acid can bind to calcium, reducing absorption significantly. You are taking supplements that aren't being absorbed, wasting money and failing to support your bones. If you take iron supplements, the effect is complex. Some citric acid can enhance absorption, but too much can interfere. The interaction is unpredictable. If you take multivitamins containing multiple minerals, lemon water can create complex interactions that reduce overall mineral availability. The bottom line is that lemon water creates an acidic environment that disrupts the carefully balanced pH needed for optimal mineral absorption. I worked with Margaret Savandi, taking calcium and vitamin D supplements for osteoporosis. She drank lemon water with every meal and with her morning supplements. Her bone density scans showed continued decline despite supplementation. When we separated her supplements from lemon water by at least 3 hours and had her take supplements with plain water and food, her next bone density scan showed stabilization. The lemon water had been interfering with calcium absorption, making her supplementation ineffective. The supplement and meal timing strategy is specific. Never drink lemon water with meals. If you want lemon water, drink it at least 1 to 2 hours before or after meals to avoid mineral binding during digestion. Never take any supplements, especially calcium, iron, or multivitamins, with lemon water. Always use plain water for supplements. If you're taking mineral supplements that are critical for your health, avoid lemon water entirely to ensure maximum absorption. Consider whether you need lemon water at all. The questionable benefits don't outweigh the risk of mineral interference for most seniors. This separation ensures you actually absorb the nutrients from food and supplements, instead of having them bound and eliminated by citric acid. If this is helping you understand the dangerous ways lemon water can harm you, hit that like button right now. It tells YouTube to show this to more people who need this critical warning. Subscribe if you haven't already, and share this with anyone drinking lemon water daily. You could prevent permanent damage. Do it now before you forget. This next one worsens kidney stones and can cause excruciating pain. Dangerous mistake number 4. Drinking lemon water if you have or are prone to kidney stones. This seems contradictory because you may have heard that lemon water prevents kidney stones. The truth is more complex and depends on the type of kidney stones you get. Here's what you need to understand. There are different types of kidney stones. The most common are calcium oxalate stones, accounting for about 80% of all kidney stones. Others include uric acid stones, calcium phosphate stones, and struvite stones. For calcium oxalate stones, lemon water may be beneficial because the citric acid can bind to calcium, preventing it from forming stones. Some studies show citric acid reduces calcium oxalate stone formation, but here's the critical problem. Lemons are moderately high in oxalate, the other component of calcium oxalate stones. If you're prone to kidney stones and consume large amounts of lemon water daily, you're increasing your oxalate intake significantly. For some people, especially those with high oxalate absorption, this can actually increase stone formation rather than decrease it. For people with uric acid stones, lemon water can be problematic because it's acidic. While the body metabolizes citric acid to create an alkalizing effect eventually, the initial acid load can worsen uric acid stone formation in some people. After 60, kidney stone risk increases dramatically. Kidney function declines, making stone prevention more difficult. Dehydration is more common due to reduced thirst sensation. Medications, including diuretics and calcium supplements, can promote stone formation. If you have a history of kidney stones and drink large amounts of lemon water thinking you're preventing recurrence, you might actually be increasing recurrence risk depending on your stone type and individual metabolism. Here's the specific danger. Kidney stones cause excruciating pain when they pass through the urinary tract. The pain is described as worse than childbirth by many who've experienced both. Stones can cause urinary obstruction, requiring emergency medical intervention. Recurrent stones can damage kidney function permanently over time. I remember working with James 77 with the history of calcium oxalate kidney stones. His urologist had mentioned that citric acid might help prevent stones. So James started drinking lemon water daily, using a whole lemon in water every morning. Within 6 months, he passed another painful kidney stone. Analysis showed it was calcium oxalate. When we examined his dietary oxalate intake, the daily lemon water was contributing significant oxalate. When he stopped the lemon water and focused on simple hydration with plain water, his stone recurrence stopped over the next 2 years. The kidney stone strategy requires knowing your stone type. If you have any history of kidney stones, get stone analysis to determine the type. Never assume lemon water is safe without knowing your stone type. If you have calcium oxalate stones and high oxalate absorption, avoid lemon water. The oxalate content outweighs any citric acid benefits. If you have uric acid stones, avoid lemon water as the acid can worsen formation. Focus on the most proven kidney stone prevention, which is simply drinking plenty of plain water to dilute urine and prevent mineral concentration. Aim for 8 to 10 glasses daily. Lemon water is unnecessary and potentially risky for stone prevention. This awareness prevents the excruciating pain of kidney stone recurrence that lemon water might actually be promoting instead of preventing. This next one causes severe dehydration despite seeming to provide hydration. Dangerous mistake number 3. Drinking lemon water as your primary fluid intake throughout the day. Some people replace plain water with lemon water entirely, drinking it all day long, believing they're super. This creates multiple problems that worsen with constant consumption. Here's what creates the danger. The citric acid in lemon juice has a mild diuretic effect, meaning it increases urine production. If you're drinking lemon water all day, you may be losing more fluid than you're taking in, especially if the lemon concentration is high. After 60, when kidney function naturally declines and when many seniors take diuretic medications for blood pressure or heart failure, adding the diuretic effect of constant lemon water can cause severe dehydration. Here's what happens with chronic dehydration. Your blood becomes more concentrated and viscous. This increases blood pressure and stroke risk. Your kidneys must work harder to filter waste with less water. This can accelerate kidney function decline. Your electrolytes become imbalanced. Sodium, potassium, and other electrolytes can become too concentrated or depleted. Electrolyte imbalances cause weakness, confusion, irregular heartbeat, and in severe cases, cardiac arrests. Your digestive system doesn't function properly. Constipation worsens significantly. Your skin becomes dry and loses elasticity. Your mental function declines. Dehydration causes confusion, poor concentration, and increased fall risk. Additionally, drinking acidic lemon water all day means your teeth and mouth are constantly bathed in acid. This dramatically increases tooth enamel erosion, which we'll discuss as mistake number 1. I worked with Robert 81, who replaced all water intake with lemon water, drinking it constantly throughout the day from a bottle he carried. He developed progressive weakness, confusion, and dangerous electrolyte imbalances. His potassium dropped to 2.9 below normal. His kidney function markers worsened. He was mildly dehydrated despite drinking what he thought was plenty of fluid. The constant lemon water's diuretic effect plus his prescription diuretic was causing excessive fluid and electrolyte loss. When he returned to drinking primarily plain water with only occasional lemon water, his electrolytes normalized, his kidney function stabilized, and his symptoms resolved. The hydration strategy is clear. Never replace plain water with lemon water as your primary hydration. Plain water should always be your main beverage. If you drink lemon water at all, limit it to 1 glass per day maximum, not all day long. Drink at least 8 to 10 glasses of plain water daily for proper hydration. If you're on diuretic medications, avoid lemon water entirely as the combined diuretic effect can cause dangerous dehydration and electrolyte imbalances. Monitor for dehydration symptoms including dark urine, dry mouth, dizziness, confusion, or weakness. Increase plain water intake if these occur. This awareness ensures you're actually hydrating your body instead of promoting dehydration with constant acidic lemon water that has diuretic effects. This next one spikes blood sugar dangerously despite lemon's reputation for blood sugar control. Dangerous mistake number 2, adding honey, sugar, or sweeteners to lemon water. Many people find straight lemon water too sour and add honey, sugar, agave, or other sweeteners to make it palatable. This transforms lemon water from questionable to dangerous, especially for seniors with blood sugar issues. Here's what creates the danger. Adding sweetness to lemon water creates a sugar-containing beverage that spikes blood sugar rapidly. Honey, despite being natural, is still concentrated sugar. 1 tablespoon of honey contains 17 grams of sugar, almost as much as 4 teaspoons of table sugar. Agave nectar is even higher in fructose than table sugar. Artificial sweeteners have their own problems, potentially disrupting gut bacteria and affecting glucose metabolism. When you drink sweetened lemon water, especially on an empty stomach, which many people do, your blood sugar spikes dramatically within 30 to 60 minutes. After 60, when glucose tolerance naturally declines and when millions of seniors have prediabetes or diabetes. These blood sugar spikes are dangerous. They damage blood vessel walls through glycation and oxidative stress. They promote insulin resistance over time. They increase risk of diabetic complications, including heart disease, kidney disease, and vision loss. They promote weight gain, especially dangerous visceral belly fat. Here's what makes this particularly insidious. People think they're drinking something healthy. It's lemon water with honey, natural and beneficial. They drink it daily, often first thing in the morning on an empty stomach. They're starting every day with a blood sugar spike that damages their cardiovascular system. They often drink large amounts, sometimes 16 to 24 ounces, getting 2 to 3 tablespoons of honey or sugar. That's 30 to 50 grams of sugar in what they think is a health drink. I worked with Susan, 72, She drank lemon water with 2 tablespoons of honey every morning on an empty stomach, believing it was detoxifying and healthy. Her fasting blood sugar readings were erratic, often spiking to 140 to 160 in the mornings. When we tested her blood sugar after her morning honey lemon water, it peaked at 175, well into diabetic range. The honey was creating a massive morning blood sugar spike that was driving her toward diabetes. When she stopped the sweetened lemon water completely, her fasting blood sugar stabilized in the 90s within 2 weeks. The sweetness strategy is absolute. Never add honey, sugar, agave, maple syrup, or any caloric sweetener to lemon water. If you can't tolerate unsweetened lemon water, don't drink it at all. Artificial sweeteners are also problematic and best avoided. If you want a morning beverage, drink plain water, black coffee, or unsweetened tea. These don't spike blood sugar. If you want vitamin C, eat whole fruit or vegetables, which provide fiber that moderates blood sugar response. This complete avoidance of sweetened lemon water prevents the daily blood sugar spikes that accelerate diabetes and cardiovascular disease. And number 1 is the most common and most permanently damaging mistake. Dangerous mistake number 1. Drinking lemon water without protecting your teeth, causing irreversible enamel erosion. We've arrived at the most universally made mistake with lemon water, and the one causing the most visible, permanent, irreversible damage. Dentists across the country are reporting an epidemic of tooth enamel erosion directly linked to the lemon water trend. Here's why this is the number 1 danger. Lemon juice is extremely acidic with a pH of 2 to 3. Your tooth enamel begins to soften and erode at pH below 5.5. Every time you drink lemon water, you're bathing your teeth in acid strong enough to dissolve enamel. Tooth enamel is the hardest substance in your body, but it cannot regenerate. Once enamel is eroded, it's gone forever. You cannot grow it back. After 60, your enamel is already thinner from decades of wear. You have less enamel reserve to lose before reaching dentin, the sensitive layer underneath. Many seniors already have some enamel erosion from a lifetime of acidic foods and drinks. Here's what happens when you regularly drink lemon water, especially if you're doing it the way most people do, sipping it slowly over time. The acid softens your enamel immediately. Within minutes of acid exposure, enamel becomes demineralized and weakened. If you drink lemon water daily, the repeated acid attacks progressively dissolve enamel. Over months and years, enamel becomes noticeably thinner. Teeth become translucent at the edges. The underlying yellow dentin shows through, making teeth look dingy. Teeth become extremely sensitive to hot, cold, and sweet foods and drinks. This sensitivity can be excruciating and permanent. Teeth become more prone to cavities because the protective enamel is gone. Advanced erosion exposes dentin, requiring expensive crowns or veneers to protect teeth. In severe cases, Teeth can erode to the point of requiring extraction. Dentists report seeing patients, particularly health-conscious people, drinking daily lemon water, with severe enamel erosion requiring tens of thousands of dollars in dental work to repair. The damage is permanent. No amount of dental treatment restores natural enamel. Here's what makes this mistake so universal. Over 90% of people drinking lemon water do it wrong. They sip it slowly throughout the morning, prolonging acid exposure. They drink it through their teeth, swishing it around, maximizing enamel contact. They brush their teeth immediately after drinking it, which actually makes the damage worse by scrubbing away the acid-softened enamel. They drink it daily for months or years before noticing the damage. By then, significant enamel is already lost. I'll never forget a case of a woman in her 60s who'd been drinking lemon water every morning for 3 years, sipping it over 30 minutes while reading the news. She developed severe tooth sensitivity and visible enamel erosion. Her dentist said her teeth looked like those of someone who'd been drinking soda all day for years. She required 8 crowns at a cost of over $12,000 to protect her eroded teeth. The lemon water habit had cost her her natural tooth enamel permanently. The tooth protection strategy is absolute and non-negotiable if you drink lemon water. Never sip lemon water slowly. If you drink it at all, drink it quickly through a straw, positioned at the back of your mouth to minimize tooth contact, then rinse your mouth immediately with plain water. Never swish lemon water around in your mouth. Never drink lemon water throughout the day. 1 glass maximum, consumed quickly. Never brush your teeth immediately after drinking lemon water. Wait at least 30 to 60 minutes for enamel to reharden before brushing. Immediately after drinking lemon water, rinse your mouth thoroughly with plain water to neutralize acid. Consider using a remineralizing toothpaste with fluoride to help protect enamel. Better yet, question whether you need lemon water at all. The supposed benefits do not outweigh the risk of permanent tooth damage for most people. If you want vitamin C, eat oranges, strawberries, or bell peppers. They provide more vitamin C with less acid and don't damage teeth when eaten as whole foods. If you want morning hydration, drink plain water. It hydrates perfectly without destroying your teeth. This tooth protection awareness prevents the permanent, irreversible, expensive enamel damage that's becoming epidemic among lemon water drinkers. Your complete guide to lemon water safety or avoidance. Here's the bottom line on lemon water for seniors after 60. Given all 7 dangerous mistakes and the serious risks, including permanent tooth damage, medication interactions, acid reflux, kidney stones, dehydration, blood sugar spikes, and mineral interference. The question you should ask isn't, how do I drink lemon water safely? But rather, do I need lemon water at all? The supposed benefits of lemon water, including detoxification, weight loss, and improved digestion, are largely marketing myths not supported by strong scientific evidence. Your liver and kidneys detoxify your body. Lemon water doesn't add to this process. Weight loss comes from calorie deficit and exercise, not lemon water. Digestion is supported by fiber, probiotics, and avoiding trigger foods, not lemon water. The vitamin C in lemon water is minimal. 1 lemon provides only about 30 to 40 milligrams of vitamin C. You get far more from eating 1 orange, 1 cup of strawberries, or 1 bell pepper without any of the risks. If you absolutely must drink lemon water despite these risks, here's the only remotely safe protocol. Use only a quarter lemon or less in a full 8-ounce glass of water, creating very dilute lemon water. Drink only 2 to 3 times per week maximum. Never daily. Drink only with or after a meal. Never on an empty stomach. Drink quickly through a straw positioned at the back of your mouth. Rinse your mouth thoroughly with plain water immediately after. Wait 60 minutes before brushing teeth. Never add sweeteners. Never drink with medications or supplements. If you have any history of kidney stones, acid reflux, tooth sensitivity, or take any medications, avoid lemon water completely. For most seniors, the safest choice is to avoid lemon water entirely and get hydration from plain water and nutrients from whole fruits and vegetables. Now, I need to hear from you. Have you been making any of these 7 dangerous mistakes with lemon water? Are you going to stop drinking it or change how you prepare it? Share in the comments because your experience could help someone else avoid permanent damage. If this video revealed dangers you didn't know about, support this mission to reach more people. Click like, subscribe, and most importantly, Share this with anyone drinking lemon water daily, especially seniors. Your parents, grandparents, friends. Send them this link. You could prevent them from destroying their teeth, damaging their esophagus, or experiencing serious complications. Do it right now before you move on and forget. Thank you for being willing to question popular health trends and think critically about what you're putting in your body. Remember, just because something is natural and trendy doesn't mean it's safe or beneficial, especially after 60 when your body's more vulnerable. Lemon water has serious risks that outweigh questionable benefits for most seniors. You now have the complete truth. The choice is yours, but make it an informed choice. Your teeth, your digestive system, your health depend on it.